Lymphedema is a lifelong condition of chronic swelling caused by a buildup of lymph fluid. It affects men, women, and children of all ages. Primary lymphedema occurs when a person is born with a faulty lymphatic system. Signs may be present from birth or develop during puberty or later. Primary lymphedema is more common in women and occurs mainly in the legs. Secondary lymphedema is more common than primary. It occurs when a person's lymphatic system is damaged by surgery, radiation therapy, or severe injury such as a burn or a skin infection. It can develop early or many years after the damage occurs.
I was diagnosed with cervical cancer 31 years ago. It was a stage 4 carcinoma, and I was very lucky to get away with my life. What I didn't realize was when they harvested my lymph glands that 31 years later that would have such a huge impact. And I've got an extremely swollen left leg with lymphedema. In the intervening years, I had breast cancer twice. So now I'm really worried that perhaps I'll get lymphedema in my arms as well.
I developed lymphedema about 18 years ago after having a lumpectomy with my left side of my breast.
I was diagnosed with lymphedema about 15 years after I had surgery and radiation for gynecological cancer.
I was diagnosed with melanoma in my left leg 2002, and it was stage 4, so everything happened very fast. I did have radical lymphectomy, lymph node removal, which left me with lymphedema in my left leg.
Hello, my name is Charla Waki, and I was diagnosed with cancer in the year 2000. So as part of that, I had radiation treatment. I also had surgery in the groin area, so they removed all the lymph nodes in my groin. And as a result of that, I contracted lymphedema. And it's something that I've been living with for the last 15 years.
My name is Julian. I got lymphedema when I was 10 years old in grade 5.
So my name is Jeff Taylor. I'm 26 years old. I have been living with lymphedema for 13 years, about half of my life.
My name is Tony. I have lymphedema. I had breast cancer 4 years ago, and I had a stage 3, and they had to take out a lot of lymph glands. So that is how I contracted lymphedema.
Hi, my name's Jan Leach, and in around 1997, and I noticed a lump in my left inner thigh, a big tumor taken out of my inner thigh. It was about 6 months recovery, but all the doctor said was, the tumor's out, but you'll have to wear compression stockings the rest of your life. And that's all he told me.
My name's Ellen Yaknis. In October 2005, I was diagnosed with breast cancer.
My name's Christine Chandler. I've had lymphedema for 25 years. It started out of the blue when I was about 50, and my arm swelled up for no particular reason. Had lots of tests to find out that I didn't have a blood clot and didn't have cancer. And following that, I was sent away with wear a stocking when you fly, and basically that was it.
My name is Lynn Holloway, and I'm one of the founders of the BC Lymphedema Association. And my journey started with lymphedema in 2003. I had a tumor in my left groin that was removed, and before I had the surgery, my surgeon told me that I would have lymphedema, and I thought, okay, I can live with swollen ankles. However, it was more than swollen ankles.
Hi, my name's Gail Reichert, and I've been living with lymphedema since October 2011, about 3 months after I had a double mastectomy. My arm started to swell, so I knew I was in trouble. One of my big frustrations coming from Alberta was not being able to find a lymphedema specialist.
My name's Joan, and I've come here today to discover about lymphedema. And
I'm here with my wife Vivian in support of her situation with lymphedema. She has it as a residual effect from having been treated for cancer, lymphatic melanoma.
Okay, so my name is Lauren and I'm a wound ostomy continence clinician at Vancouver South Community, and I deal with a number of different lymphedema clients or patients.
5 years ago, my daughter developed primary lymphedema.
I've been a massage therapist in Powell River for 26 years, and I just received training in treating lymphedema less than a year ago.
Hi, my name is Carol Armstrong. I'm a lymphedema therapist and a medical garment fitter. I've been working with lymphedema for over 25 years, or about 25 years.
My name's Melanie Brancato. I'm a registered massage therapist here in British Columbia. Vancouver Island is where I practice. I see all different kinds of lymphedema, primary lymphedema, secondary lymphedema, most common post breast cancer intervention.
Hi, I'm Adrienne Parks. I'm a registered massage therapist.
Hi there, my name's Catherine Bowman. I'm a grade 12 student researcher. My research currently is focusing in on lymphedema and lymphatic disease.
I think it's important for people to talk about the lymph system, and I think it is the most important system in the body.
I do have 3 younger children, and when I first had my twin boys, it was very difficult for me to hold them.
And I'd like to just share with you the garments. The first one being a nighttime garment. This is what I have to wear every night. A garment that I have to wear all day, every day, if I'm to control my lymphedema. And this beautiful looking thing here is what I have to wear every day. And as you can see, it has an impact on physical movement, which makes life a little bit more difficult. And finally, because I have pelvic lymphedema, I also have to wear a bag of cherry pits to try and counteract the fasciitis that I developed from my lymphedema.
I bought myself a compression pump, use it every night. I have used it every night for about 7 years. Things like flying, sitting at a desk all the time, those bother it. Found that there was not a lot of information about any of this. If I had it in my arms, there was a lot out there. In my leg, there was not a lot of information out there. My doctor knew nothing about it.
It's been a struggle. Some of the issues that I've faced with lymphedema is limited mobility in my leg, so it does swell, and it changed some of the activities that I was able to do. It is a bit frustrating, and oftentimes it really affects you emotionally, I would say, because you look a little bit different, your leg is a little bit bigger, because it is something that I'll be living with for the rest of my life. When I'm at the office, I sit with my feet up. When I come home, I put my leg up above my heart.
Manage it just by wearing my compression stocking all the time. I feel like a lot of things kind of like are bothersome maybe, but the compression stock, once you get used to it, is pretty fair. Or, keep my leg elevated at night. I have a bed like that. I get cellulitis maybe used to be once a year, once every 2 years, and then now it's maybe once or twice a year. There's difficulties just like pants and stuff. It's always annoying.
I used to be a frequent flyer in the hospital system with cellulitis infections. I think the most I ever had was maybe 4 a year, and they're really devastating.
I've had 6 cellulitis infections. They gradually became closer in proximity and more intense. And then the next thing, I'm in emergency and I'm on 7 days intravenous. The very first time in 20 odd years that I ever got any instruction in how to manage my arm, how to bandage it, exactly what kind of stocking to wear. The stockings I'd had been off the counter and not really doing that much good.
I wear compression stockings every single day, and I have for the last 10 years. It's something that I'm managing every day. That over the last 3 or 4 years, that's been getting worse.
Living in Victoria is a real problem. We don't have very much help there.
But I didn't know that it was lymphedema. Nobody had said that. Now I'm a teacher, so I wanted to go back full time after my surgery. But I couldn't because you stand for long periods of time, and that's not very good for your legs. So now I've been part-time for a long time. On the days I work, I really, as soon as I get home, I go on the machine, the FlexiTouch machine.
And I saw that my left wrist hand, I couldn't see my knuckles, it was completely swollen. Nothing was available for anyone with lymphedema. I've been wearing compression glove, compression sleeve since that time. Lymphedema is painful. Walking is sometimes a problem because I don't know what to do with my hand as you walk and it swings down. 10 years I've had all this nonsense.
One of my big frustrations coming from Alberta was not being able to find a lymphedema specialist or somebody that could tell me what to do or how to deal with it. Another frustration I have as a lymphedema survivor, I guess, in BC is the doctors don't seem to know how to deal with it. My first time that I got cellulitis, I was in emergency every day getting intravenous antibiotics.
I've had no help in learning how to bandage it, no help on how to control it. I'm not able to work properly because of the lymphedema, so I can't earn any money, so I can't buy the things I need to treat the lymphedema so that I can work. And I feel like I'm caught in a completely vicious circle. It sounds silly, but I can't wear shoes. I can't get any boots on. I live in a place where it snows a lot, and I don't know what I'm going to do this winter because I can't get my boots on.
Some of the common problems that patients face following cancer treatment is the potential for lymphedema to develop. And presently, there is not a lot of information or awareness around the very early signs and symptoms of lymphedema, and that is really important as we keep learning at these conferences. As with any chronic disease, the earlier you can catch it, the easier it is to intervene and to potentially halt the progression and prevent secondary tissue changes from occurring, which are more permanent in nature. One of the complications with lymphedema is the progression and challenge to the immune system. Lymphedema patients are very susceptible to risk of infection, and once they've had one bout of infection, it causes further risk of repeated infection. The form of infection most commonly associated with it is cellulitis, and that can become a life-threatening situation.
It's just a vicious cycle for them because they can't afford it, because they can't work, because they have lymphedema.
At the beginning of our journey with lymphedema, it was a little bit frustrating, and for me as a daughter of my mother who had lymphedema, I really wanted to make a difference in the lymphedema community. And so about 8 years later now, I'm currently working in 2 different laboratories.
So many people don't have the finances or the physical ability to get to treatment. So they're already struggling with either in a large limb, trying to just wear clothes, function in day-to-day life, because once your hand is affected, you lose dexterity. People who are having to change their jobs or modify jobs or try to find ways to work with their employer to allow them to work part-time, because if they work too much, then that exacerbates the edema. And a story that one of my clients told me that it hit me so hard and made me realize how important our work is. She had a lot of edema in her chest wall and her breast, and we were working at trying to get compression right. And I was trying to find out how she felt it was, and I asked her, so has your husband noticed a difference? Does he notice it's down, it's up? And she just looked at me and went, I don't let him see me like this. And it almost made me cry, because I thought, this woman is dealing with this physical disfigurement to the point where she doesn't want to allow the people that love her and want to support her see it, and it's such a stigma.
You know, to be doing the right thing for my body, I should be getting manual lymph drainage multiple times a month. I would ideally love to do it weekly or bi-weekly, but it is very pricey.
I got a nighttime garment. I researched for that on my own and found nighttime garment, which I used. Then I heard about the FlexiTouch machine. It's an air pump machine, compressive pump machine, and it cost me $5,600. And so that's what I use, is the FlexiTouch machine every night, my compression, and my night compression.
I have no
finances to address this problem. The bandages, I can't afford them. The special garments that you can wear that make the bandaging not so cumbersome every day, I can't afford them.
So I would go to our local hospital and have physiotherapy treatments where they'd put me on a pneumatic pump for about an hour each day, and then I'd walk out of there and my leg would fill up again. So that wasn't really doing anything, and I was spending taxpayers' dollars having this done. I think I had 80 some odd treatments. So I spent the next 2 years trying to get a stocking. A stocking for me is $200. It would be wonderful to have 4 of them a year. You know, the massage therapy is almost $100 an hour, and that would be wonderful to have at least once a week, and definitely once or twice a year do an intensive for a couple of weeks, but it's just unaffordable.
The garments to help treat for lymphedema once we've stabilized it are incredibly expensive and outside of the average person's budget.
Most patients that need it can't afford it because they're living with a condition that is debilitating. They can't work because their arms are swollen. They can't.
Treatment is currently expensive. It's often only available through private clinics, and there isn't medical funding for that, or very minimally so. The other part that's important with lymphedema is management through compression garments. And compression garments are ready-made compression garments are fine for early stage lymphedema or if there aren't any secondary tissue changes, but with the advancement of the disease, it's important that the patient has the right kind of garment with the right compression class and fabric in order to manage their condition effectively and prevent it from progressing. These garments are very expensive.
So if they can't afford, you know, a custom garment, that does become a barrier to living a good quality life.
Early intervention, compression management, and treatment with manual therapy, exercise, skin care, it's very important to these patients in order for them to be able to manage their lives.
The conference today is excellent for information because I'm learning things that I never even knew about before.
The little connections that have been made here have made a big difference for my better understanding.
Just more information, more access to information is always a plus.
And I finally found the BC Lymphedema Association just last year and joined. It would be wonderful to have the government step in and cover some of these costs or help us cover some of these costs because it is something that I'll be living with for the rest of my life.
If I could tell the provincial government something, I would tell them that this is not something that you do, that you contacted because you were doing the wrong things. It just happens. And people with lymphedema need a lot of help because it's very expensive. And places like Alberta and Quebec are way ahead of us in BC. And of course the rest of the world is basically way ahead of us in BC. So I would like to see them fund everybody that cannot afford it.
And now I'm just grateful that I found that organization, and because of that, that's why I've stepped up to the board, because I don't want other people to have to go through 20 years of infections that I have experienced. And my goal is I'm never having another infection.
So it was just so delightful to meet other people and to talk story with each other about what we've all gone through. It seems ridiculous to me that women who have breast cancer are able to get a compression garment for their arm, but I can't get one for my leg.
I would ask the provincial government here to step up your role in helping lymphedema patients and their caregiving networks to deal with it. When I lived in Calgary, if you had lymphedema from breast cancer, there was a hospital that you could go to and you didn't have to wait for months and months and months to get referred to a lymphedema specialist. You just went zip and you were in the hospital. I would just urge the provincial government here to step up to the plate and start helping lymphedema patients more actively.
And I'd really appreciate if the government looked further at lymphedema and the coverage that our population has for lymphedema garments.
Trying to spread the word of lymphedema, not only to patients, but also to the greater community, to care providers, to family members, and again, to the patients themselves, to really be able to act as that person that is able to provide some support, comfort, and some answers to those unanswered questions, as I remembered from my beginning in the lymphedema community as well when I was 8.
More help is needed financially, more education is needed, more support. I just wish there would be more doctors here at this conference day to educating themselves about lymphedema. I'm so saddened every time I hear from a new member that they have struggled to get help from their medical community.
I've had no help in learning how to bandage it, no help on how to control it. I'm grateful to this conference because I've probably learnt more in one day than I was able to find out in 14 months. Yeah. I just want the government to help us all.
Thank you to all our BCLA members. Your commitment is essential in building a network of support for British Columbians living with lymphedema. A special thank you to each person who participated in this video. Your personal stories are a powerful way of reaching out to people living with lymphedema and their families, as well as to the medical and political communities. They extend awareness of this disease, thus creating the opportunities to limit its progression. They describe the burdens of living with lymphedema. They advocate for financial, medical, and emotional support for British Columbians living with lymphedema. Thank you for shining a light on lymphatic disease.